Hello, my name is Cassandra Walton. I stand before you today wearing two different hats. So from 9 to 5, many days of the week, I work as the Executive Director of Pikes Peak Suicide Prevention. And for 24 hours a day, 7 days a week, I'm a mother of a child who struggles with mental illness. So I'll start with the Executive Director hat. So many people have said so many things that I don't want to repeat, but I agree with in this. So I'm going to just talk about a small segment of prevention that I think there are some very tangible things that we can do in order to support suicide prevention in our community. Suicide prevention starts far before the word suicide comes into play. I recently spent 2 days at Doherty High School doing a panel discussion, talking with all of those students about being a student navigating mental illness. What we need to realize is that we really need to start talking about mental wellness with our kids when they are very young. Our elementary schools need to start focusing on helping them to learn self-regulation skills and building resiliency. This kind of coursework could go all the way through middle school, following the developmental challenges that they'll have at each age, providing them with skills that they need, and also normalizing accessing mental health support services. In 2017, Pikes Peak Suicide Prevention worked with El Paso County to do the teen think tanks. At that time, those teens had so many great ideas. One of them was that they really wished that just like you have to check in with your counselor on a scheduled cadence to talk about your schedule, that in order to maybe normalize accessing mental health services, there should be a mental health check-in as well. The other protective factor that this would help to reinforce is having that trusted adult. So oftentimes when you start talking about a student in crisis, you hear the response, you need to go see your school counselor, which is true. School counselors are gatekeepers to many services. Many of them have the ability to provide some individual support for the students. However, I just want you to remember being a teenager, having that really intense emotion, and think about opening up about that to a stranger, or someone you've only talked to by appointment a couple times in a school year. That might not be an ideal situation for you to be vulnerable and for you to be willing to talk about the things that are closest to your heart. With that being said, I know that there is current attempts to push legislation for education staff to be trained in mental health practices such as mental health first aid or QPR. I think that it's very, very important that in addition to creating more ability for people to be trusted adults, we need to support these trusted adults with the education and training that they need to be able to provide the appropriate support in those crisis moments. In addition to that, running my center, one of the problems we run into is access to care for many individuals. When you talk to many of these teenagers, because of this lack of normalizing the idea of mental wellness, many of them don't feel comfortable talking to their parents about the fact that they need mental health support. I had a young girl at Doherty tell me, my parents aren't gonna pay somebody to talk to me. There's just a lack of understanding of the importance of accessing mental health services. And so really we need to start, and we've said it a billion times, normalizing the conversation about mental health. And that can really be done by incorporating some very normal things within the schools at all ages across elementary, middle school, and high school, and into the college years. I'm going to take my last few minutes to put on my mom hat and talk about what it's been like for us as a working class family, our ability to access care, the quality of care that we have come across, and the cost of care. So first off, because the idea of a child having mental illness is not really a common idea, usually when our children start to exhibit signs, it looks like behavior. Right, so we go into behavior management mode. That's what the school is working on. When I look back at my daughter's journey, we really should have started accessing mental health services in elementary school, but we didn't think about it that way. She had her first suicide attempt in middle school, and it was just by luck that I had forgotten something and came home to find her. From that point on, being a mom who works in the field, I still struggle to navigate our system here in Colorado Springs. I struggle to know where to go and what to do. I struggled because I have 3 other children who need my care and I have a job. And when we went to go get a mental health assessment, I had no idea what to expect, that we would sit for 6 hours or more each time, waiting for her to be evaluated, and then wait several more hours for them to locate a bed. And that sometimes that bed would be so far out of the city that I would have to change my entire life and the lives of my other children in order to be able to make visitation or family therapy appointments. All of this with just like a regular salary. So you have to think, we do have insurance, but what I've realized through this process is that we are underinsured. We can't, it's really hard to afford all of the services that are required to maintain her care that she will need for the rest of her life. And so it really impacts our household as a whole. And so that being said, that means that everyone in our household requires a certain level of support and understanding, both from our employers, but also from the schools. Does that mean my time is up, or did I have 30 seconds? Okay. So schools are doing a much better job of a reentry plan when a student has been placed into the hospital and is returning. They need help. They need help to understand what ongoing support for these students needs to look like. Employers need help understanding and maybe some mandates of what support should look like for the employee who is supporting a family member with mental illness. If it was a different type of health issue, it would be treated by both the employer and schools in a much different, more supportive way. And so thinking of labor laws or different things that we can look at to support those families who are supporting individuals with mental illness is really very important. Thanks for listening to me today.